Hi everyone. In November of last year, I interviewed Professor Hsu Chung Hua, a clinician, researcher and author who drew on his experience treating SARS in 2003 in order to develop a preventative herbal formula for COVID-19 in the early days of the pandemic. His goal was to offer some protection to frontline medical staff in the time before a vaccine was developed. I interviewed Professor Hsu about his experience as both a doctor of Chinese medicine and Western medicine, as well as the theory behind this formula, known as Jing Guan Fang, and the ongoing research into it.
Do you know that Dr. Hsu also saved a lot of people during 17 years ago? There's a SARS.
SARS.
Yes.
2003 years.
The leader in Taiwan.
I will prepare.
Really?
Yeah.
I know they say that Taiwan learned a lot from SARS when it came to COVID-19.
In that time, I'm working in the Chinese, but I'm back to the Western medicine.
Okay.
I've been working the internal medicine. I'm a professional. The Western medicine, I have a well training.
Right.
So because the SARS attack, so really called me to back. So I'm the first line to care the SARS patient. So I in that time we also give the Chinese medicine for the severe, the laboratory confirmed SARS patient with the Chinese medicine.
Okay.
We got some clinical experience and do the research. So in the pandemic disease like the SARS or the COVID-19, I think the Chinese medicine will be help people because in the past 100 not the vaccine, not the antibiotic, but still have some kind of very similar the disease.
Yes.
So the people or all doctor or they have to facing and to treat the patient because at that time no vaccine, but the first time the healthcare worker have to facing and to treat to care the patient. So we give to our college. So almost 90% of the patient, our college, the staff, use the Jing Guan Fang, and this is very interesting. We also give some the patient that in all those the patients in the Mesado.
Yeah.
You know the Mesado, the drug, because
withdrawal from opioids.
the drug abuse. The drug abuse because they are, I think that they are the label there will be mistake.
Low priority.
Low income and nobody want to care them. And my hospital was also to care. The one branch of my hospital. 我们那时候就 free of charge send.
So they were also given
Every day.
Yeah.
No, they don't need to pay. Instant be lower in the population in the country, in the community.
They didn't infect the COVID. Yeah.
Normally, this patient is high risk.
Yes, of course.
Yeah.
Because他们一定要来万华，万华呢就是一个
That area, Wanhua area,
the
is
pandemic area.
Yeah.
Okay.
Yeah.
But we give them free of charge to help them. They take the Jing Guan Fang can shorten the patient symptom and the severity in high risk patient, like a cancer patient, the Mesado patient, the cancer patient. I think this is the easy to get and the severity when got.
Yeah.
But after they take it, before to get exposed, before the exposed, they taking the Jing Guan Fang first, so that can be protect.
I also spoke with Professor Tung-Yi Lin, whose ongoing research into Jing Guan Fang is not only demonstrating its safety and efficacy, but also its very unique mechanisms of action.
I just thinking why the Jing Guan Fang can prevent the virus infection. So the important receptor is ACE2. So I just focus on maybe the Jing Guan Fang can affect ACE2 or virus. So in my lab, we do two important studies. One is to check the Jing Guan Fang affect the host cell, and then another issue is to examine how about the Jing Guan Fang affect the virus. So in the virus studies, we cover with some study to demonstrate that Jing Guan Fang can inhibit virus replication. So we use a Jing Guan Fang to treatment host cell, especially on lung cells. And we found that the Jing Guan Fang can reduce the ACE2 expression. So this is let us so happy why the Jing Guan Fang can affect the host cell ACE2 expression. So we do some mechanism and demonstrate Jing Guan Fang can induce the ACE2 degradation.
ACE2 is like the door. Open the door. The virus want to. This is the cell. The virus is small, so they will be linkage to ACE2, and then they can come inside. So the animal model show that the treat with the Jing Guan Fang, this ACE receptor, this is like a door. The virus come to the cell inside will be shortened almost 50%.
Right.
If
100 door and
become 50 doors.
Yeah, 50 doors.
Yes. It has been found that Jing Guan Fang's mechanism of action actually changes over time. While it initially focuses on inhibiting ACE2, over time it ceases to do this and instead switches to inhibiting the TMPRSS2 protein. I find this an absolutely fascinating example of the intelligence of a well-constructed herbal formula, which can change its mechanism of action based on the circumstances of the patient without altering dosage or the composition of the formula.
And the other important things that we also found that the Jing Guan Fang can affect the TMSSPR, but we do not find that the Jing Guan Fang can induce the TMPRSS2 protein degradation. We just found that the Jing Guan Fang can affect the mRNA level of TMPRSS2. So we think maybe the Jing Guan Fang, in the first time, it can quickly induce the ACE2 degradation, and then for a long time, it can affect the TMPRSS2 protein expression. So this is a very important finding for us to know why the virus cannot affect the host cell, because Jing Guan Fang can affect the host cell, so the virus cannot infect the host cell.
Another fascinating finding involves the tissues and areas of the body that are affected by Jing Guan Fang. ACE2 and TMPRSS2 are found not just in the lungs, but also in the heart, the kidney, the colon, and the brain. However, on examination of the tissues of mice exposed to Jing Guan Fang by inhalation, they've found that it only inhibits these proteins in the lungs, nowhere else in the body. So this is a really interesting demonstration of a uniquely Chinese medicine characteristic, that idea of the channel or organ entered of each herbal medicine. And if you look at the composition of Jing Guan Fang through this light, its intended areas of focus in terms of Chinese medicine match exactly with what's been found in terms of the ongoing research.
And then another way we use the steam. We use the steam method that the Jing Guan Fang can use a brief mouse brief Jing Guan Fang receive the Jing Guan Fang by brief. We found that when mouse receive the Jing Guan Fang, also can reduce lung tissue ACE2 downregulation, but do not affect the brain or kidney or colon tissue ACE2 expression. So it's a very specific target for the lung tissue. So this is let us more exciting. The Jing Guan Fang just only can affect the lung tissue, can prevent a virus infection. So this is our major finding in these papers.
If you are treating wind heat in the upper Jiao or something like this, a lot of people think of Tung-Yi Lin or Yin Chiao San, but these are only lung system. But Jing Guan Fang has a lot to do with the digestion as well.
It's a
Hsu
will be treated.
So you were thinking more.
The whole body. So it just stop the pathogen from this side. At that time, I think I want to create a drug. It's very simple and easy to buy, not too expensive, and easy to cook it, to make, and they can totally cover. So I have to to with my mind to create no so many kind of the drug.
Yes. Yeah, yeah.
So it's a 咽喉, 连翘 here, and the lung is 黄芩,
It's good.
and the whole 你知道那个
exterior.
sear and the muscle and the 胃分气分 this is the 柴胡
Yeah,
柴胡
yeah,
柴胡后破是 stomach and the lung
And lung, yeah.
and the 藿香 is
Pocostemon.
can two area either outside of the air 这是
yes.
and the inside of the stomach
老师你要讲胀气对不对？
对对对对
Miasma.
Miasma,
Something
yes.
you can see.
Yes. Yeah. So when I look at this formula, for me it looks almost a little bit similar to like Xiao Chai Hu Tang.
交叉
You know, you were ascending with the Yan Xiao and the Chai Hu, you were descending with the, the Huo Po, and then you were tonifying the middle with the Huo Po and the Huo Xiang. Yeah, where did your inspiration come from? Or is it just pure
I
experience?
think the from here
More windy.
the 柴胡 will be here 胃气 胃气 but our the design is very similar almost the similar but the 柴胡 is a lot of the upper area only the 黄芩 to cover so 柴胡 not the 连翘 so I think the 连翘 is a our drug is very like the 小柴胡汤加上 and 连翘
Yes, and Yan Xiao is more of a wen being herb.
Yeah,
So
yeah,
yes.
because from the symptom in the initial the COVID-19, it told me I read so many the report and we are facing to contact with the patient. So many clinical symptoms is in this area.
Yeah.
如果从胃镜影响是 very similar. Our the Jing Guan Fang is the 胃气 is the same. 胃 is the most. Yeah, maybe here is the 80%, either 20%
Okay.
to treat. But 小柴胡汤 almost 差不多一半一半50-50.
Yeah. Yes, okay.
So our the Jing Guan Fang to be used early. Very important is early.
Yeah, so still
early as
chi, wei and
possible.
chi level. Yes.
And not chi before the weight.
Before chi wei level.
And weight level.
Right.
Before the weight, this is the better.
Yeah.
So and I will go to the take a plan. Before I take it, will be protect.
Yeah.
Also, if even we contact the virus or contact the pathogen, they come to here, no problem. We can defense in the surface, in the upper area, in the beginning.
Professor Fang Pei Chen is the director of traditional medicine at Yangming Jiaotong University, and she had some very interesting thoughts on the difficulties and nuances of measuring what we call immunity, specifically when it comes to Chinese medicine interventions.
Immunity, because I mean the indexes to say immunity functions are a lot. Cells or cells immunity or humoral immunity, a lot of so any kind of research can mention this. Say, oh, I'm giving this medicine or I'm giving the acupuncture, and then we check the body through the lab examination, and you found oh this increase or that increase. So you say the immunity is increased. You see, indexes are a lot of terms, right? Okay, then is the human body's presentation. How show you're healthy? How you feel you're healthy? This another way, another term. So there are many research papers, articles showing that it can do that. I mean, acupuncture or herbal medicine.
And then we also continue to do some experiment to demonstrate how about the Jing Guan Fang immunomodulatory. So because the Jing Guan Fang is a herbal formula, so we believe it can regulate immune system. So in my study is ongoing to do some study. We check the Jing Guan Fang can reduce polysaccharide called LPS is a bacteria component can induce a very strong inflammation response. So we use LPS to stimulate macrophage. It can induce inflammation. We also check the Jing Guan Fang can significantly reduce LPS-induced inflammation response. And then yesterday I asked my student to check how about the Jing Guan Fang affect the SARS-CoV-2 induced inflammation. So maybe next we want to check how about Jing Guan Fang affect the inflammation by the SARS-CoV-2 induced response. So this is our future work.
Do you have a background in Chinese medicine, Professor Lin?
其实没有啊，对，所以这个
Were you surprised to see a Chinese herbal medicine formula have these effects on cells and on the immune system?
Yeah, I think everyone can eat the herbal formula because it can promote your body health. So also I think not only choose the Western drug, maybe the herbal formula is best candidate for person or human to eat the herbal formula. It can promote health, and every day you can eat it. Herbal formula, I think, is a very best candidate for everyone.